let's talk about bone, joint, and muscle injuries, musculoskeletal. And it's a pretty short lesson, and really just want to stick to the basics. But if you haven't looked at the videos in that lesson tab for today, please go over those videos. So as I was saying before, what would happen if you came up to a situation like this? Pretty grotesque looking injury, isn't it? What would be your first concern? Anybody want to take a stab at that? Would your first concern to be put that leg back in place? Would your first concern be to give him some pain medicine? Your first concern would be how to get him to emergency services? Okay. But that's going to take a few minutes, correct? Internal bleeding? Well, it looks like that's always well, you know what? That's actually a good thought. And what are signs and symptoms of internal bleeding? Basically, signs and symptoms. So you guys are doing good. You're not focusing on this horrible, grotesque injury that you see here, because as nasty as that injury is, it's very unlikely to kill him. This is a gymnast in a gymnastics event. He landed incorrectly off the vaulting exercise, which involves a lot of speed, a lot of height, and a lot of rotation. So one thing you got to worry about is, did he land so hard or wrong way where he hit his head, hit his neck? Is he awake? Is he breathing? Does he have blood in his body? Well, obviously he appears to be awake because he's holding his leg, he's grimacing in pain. If he's screaming in pain, that's a good thing. But if he's just lying there kind of unresponsive and you see that grotesque mangled looking leg, that's not what you want to focus on first. The first thing you want to focus on is checking to see if he's responsive. Are you okay? Are you okay? You want to check and see if he has any signs of life. Is he breathing? Is he moving? Is he walking? If he's not doing any of that, does he have a pulse? A carotid pulse? If he doesn't have a carotid pulse, forget about that leg. You got to do CPR. Assuming he does have a pulse or is showing signs of life, is he breathing? Is he breathing adequately to support life? You know, if he hit his head or his neck, he may have screwed up his respiratory system where he's only breathing once every 15, 20 seconds. That's not enough to live. You may have to take over his breathing for him. And of course, is airway open? Well, if he's screaming, if he's breathing, his airway's open. So always remember those ABCs before you go on to those injuries. Remember that primary or initial check. This grotesque lower extremity injury is only going to be handled in the secondary check after we've attended to the life-threatening problems. And that's a real important take-home message I want you guys to remember. So as we're talking about these type of injuries, let's talk about certain terminology that you guys should be familiar with. Sometimes people confuse fracture versus break. A fractured bone is a broken bone. There are many different ways to break a bone, but anytime there's a disruption in the continuity or the makeup of a bone, it's called a fracture. And we're not going to get into all the different types of fractures that you can come into, but the two terms are basically synonymous. A fracture can be either open or closed. Obviously, I think you know the worst one of the deal is an open fracture, or a fracture where the bone is actually sticking out of the skin, because then you got to worry about blood loss, infection, and damage to other structures. A dislocation is when a bone comes out of its normal place from a joint. Generally, it doesn't include breaking of the bone, but it can include ruptures of the ligaments and the tendons that hold the bone in place. A sprain is simply a stretching or tearing of the ligaments. And as you remember from the second day of class, ligaments are structures that hold bones together. So when you sprain an ankle, you're stretching the ligaments that hold that ankle in place. It could be a minor sprain where it's just a little partial pull, or a major sprain where that ligament is almost completely torn apart, sometimes needing surgery to correct. A strain is simply an overstretching or maybe even a partial tearing of a muscle or a tendon. Muscles and tendons tend to heal very easily. And we talked about a closed versus open extremity injuries. the worst of which being the open injury itself. So, okay, we already discussed that, open versus closed fracture. And there's some other different types of fractures. Now, I'm not going to hold you to identifying what type of fracture is what, but a comminuted fracture is one where it's broken in several places. A transverse fracture is a break right across the bone. But what's typically peculiar is what you would see here, something called a green stick fracture. This one I might want you to kind of commit to memory, a green stick fracture, an incomplete fracture. If you can zoom in on this picture here, you can see that the bone is kind of bent and cracked on one end and intact on the other end. Almost like you were taking a tree branch that was still kind of moist, pulling it apart, and then seeing it crack on one end, but the branch still intact on the other. Who do you think is most likely to suffer that type of extremity injury? What type of person? Any thoughts? Silence, crickets, crickets. Actually, small children. It's more likely in small children. Children do not have the calcification or the hardening of bones that adults do. So when they injure their extremities, you usually have more of a bending than a break. Sometimes it can be difficult to identify on x-rays. As we get older, though, our bone structures tend to pack on more calcium, pack on more rigidity, and they're easier to break. That's also a problem when you're talking about severe chest trauma in small children. A child gets run over by a car, so to speak. They may have been crushed. In an adult, you may feel a broken rib cage and be very, very gung-ho to treat that injury. Children may not have broken ribs, but that car may have squashed over their chest, crushed the organs underneath the chest wall, and sprung back up, and you would appreciate it. Real high index of suspicion. I think I talked about early in the first day of class what got my interest in first aid was my friend in high school shattering his leg. He received something called a comminuted fracture. A comminuted fracture is something just broken in many different places. Probably requires surgical pinning and plating to recover from that. So what type of fracture you have there really is more academic than anything else. It really doesn't matter because any type of extremity injury that we talk about is pretty much treated in the same way. You're going to look for the external features. And remember the acronym we talked about, the DOTS, D-O-T-S, deformity, open wound, tenderness, swelling. Either way, it's going to whether it's a dislocation, fracture, the treatment is all pretty much the same, and we'll talk about that in a few minutes. But the first thing to do is to look at some of the signs of injury. Loss of use, guarding, okay? This is what we talk about as far as deformity. Crepitus, I love the sound of crepitus. I love when they talk about crepitus. Crepitus is a sound, is textbook, a sound of bones grinding against each other. In real life, crepitus is the sound of somebody screaming bloody murder as their bones are grinding together. Not something you want to really experience or as either a victim or a rescuer. So as I mentioned before, when caring for an injury, the first thing you want to do is check for life-threatening conditions. Look for the ABCs. Gently remove clothing covering the injured area so you can evaluate it. Now, obviously, within reason, within your ability to do so, and also respecting the person's modesty. But I really can't tolerate EMTs that bring in patients into the emergency room saying, oh, I think he's got a fractured, fractured tib fib or fractured femur, and the pants are completely intact. That tells me they did no examination whatsoever. And then again, examine the area by looking and feeling for the deformity, open wounds, tenderness, and swelling. That is something you may see on next week's exam. Hint, hint, hint. Next thing you want to do is think about the mnemonic CSM, circulation, sensory, motor. Do they have good circulation? Do you feel good blood flow in the distant part of the extremity? Are the hands and feet, are they pink? Are they warm? If you know how to feel a pulse, definitely try to check for that pulse. Feeling a pulse in a foot is not very easy, though. You have to be a little bit experienced in that. But if you can't feel a pulse and that foot is nice and warm and nice and colorful, I wouldn't say worry about it too much. If you can't feel a pulse and that foot is blue and ice cold to the touch, even if the room temperature is warm, that's a sign of a serious injury. That's an injury where that foot may not be getting the blood supply it needs, and it may wind up dying off. Sensation. You want to basically just see if those nerves are working. Now, I mean, you're not going to put in a full exam like a neurologist would. Just simply, can you feel my finger? Can you move your finger? What finger am I touching? What toe am I touching? Can you wiggle your toes, wiggle your fingers? That's really all that matters. And movement, same thing. You don't have to go through different ranges of motion. Just see if there's gross movement. Now, why is that important? Well, again, person may have sensory, they may have warmth, they may have movement now. 10 minutes, they may lose it. And that tells us a lot of information in the emergency room about the progression of this injury. That it could be getting worse, that things could be swelling up or constricting in the inside of the extremity. Something that may have to go right to the operating room. But it's always a good idea to know how the injury is progressing. What would you do for this open fracture? Ooh, that is nasty, isn't it? Oh. But again, remember, as grotesque as this injury looks, with the tibia sticking out, with muscle sticking out, a little bit of blood, this, unless it's pumping away from an artery, this is not likely to kill an individual. All right, it's the fact that they're not breathing because they hit their head as well, that's likely to kill them. So for this, you want to try to stabilize the part. And stabilizing the part is very easy. That's most of the first aid that most of these injuries really require. It's just taking your two hands, gloved hands preferably, and holding the extremity in place to prevent any further motion and any further damage to the extremity. Now, this is an obvious open fracture. Do not try to put the bone back in. I think that's pretty self-explanatory, but Grandma always said common sense isn't very common. The biggest issue here is blood loss. Doesn't look like there's too much blood loss occurring here, but we still want to try to prevent any further blood loss and further contamination. So you would want to stabilize the injury, not put back any bones, and try to apply a clean, preferably sterile dressing on top of the wound to keep it from becoming contaminated. What about injuries to the joint? What is a joint? I know what you're thinking. A joint is anywhere where two or more bones come together. All right, sorry for the little pause there. So most joint injuries involve something called a dislocation. A dislocation is where the bone actually comes out of place. It's very painful. It's usually you'll know it just by the way the individual reacts. They're not going to want to move that extremity at all. They're going to probably hold it in place with their other extremity, something we call self-splinting. No, I just had to turn my mic off for a minute because my little 4-year-old strolled in here wanting to she made me some homemade something, and I'm actually afraid to look at it. But as far as dislocations go, what joints do you think are more likely to become dislocated? Immovable joints, ball and socket joints, hinge joints? Any joint can become dislocated, but what do you think is more likely? Well, two most commonly injured joints are the shoulder and the hip. And what type of joints are there? Does anybody remember? Those are ball and socket joints. They have a huge range of motion. And remember, the more mobile a structure is, the less stable it is. So the less stable it is, the more prone it is to injury. That's why we usually have more shoulder dislocations than we do other joints. So how do you recognize a joint dislocation? Well, deformity, as we said before, severe pain, swelling, inability of the victim to move the injured joint. But that could also happen with a fracture, couldn't it? Yeah, it could. So this is more academic than anything else. The most important thing is that we don't aggravate or further damage that joint. So what you're seeing here is very likely a posterior or a backward displaced elbow dislocation. Now this comes into problem if that dislocation compresses blood vessels and everything downwind from that dislocation becomes compromised with blood flow. So what do we want to do for these type of injuries? Well, you want to try to immobilize them as best you can. Upper extremity injuries are immobilized very well with a very simple piece of equipment that we've talked about before, a triangular bandage. And this is why it's important to look at the videos to see how to go about doing this. Triangular bandages make very good makeshift slings. As you can see here, this guy's working up all the attention he's getting from these two EMTs. Probably injured his shoulder, elbow, wrist, one way, shape, or another. So they want to apply something to help immobilize it. So they drape the triangular bandage over his body and they stretch it out and flip it up and tie it into a makeshift sling. Now, if you want to look at this picture here, can anybody tell me what's wrong with this picture in particular? They did everything appropriately up until this point. Any thoughts? So you can see she's got gloves on. Looks like she's checking his distal pulse before and after. Nobody recognizes what's wrong? No, the thumb is okay. It's just hidden behind the rest of the hand. Nope, not necessarily. Good thought. I mean, this is a very caveman. And Getty, good job. Yes, the ring, the ring, the ring. First thing you want to do is get any jewelry off that extremity, because what's going to happen as that hand starts swelling? As that hand starts swelling, that finger's going to start swelling, and that ring is going to start cutting into the flesh, and then it's going to have to get cut off in the ER. And if it can't get cut off, it's going to compromise blood flow to that finger and cause more and more damage. So the first thing you should do upon stabilizing that injury is make every effort to at least have the victim or you yourself try to get that ring off of that hand. Use soapy water if you can. Do whatever you can to make it happen. All right, these are just more pictures of technique more than anything as well. So look at this. This is just an example of a probably fractured forearm. In legal sense, we can't really say it's broken because we don't have x-rays available to us pre-hospital. And if we did, you know, what would we do with them? It'd be kind of cool if I had x-ray vision, but I don't. But as you can see, there's a joint here and there's a joint here, and there's probably a joint here. So what's the first thing you would do with this? Well, first thing you would want to do is make sure the person's alive. It's going, ow, my arm, ow, my arm. If they're saying that, well, you know their airways open, they're breathing, and they have circulation. Now the question is, do they have circulation to this hand? So first thing to do is once you require all that, you get the person's informed consent to help, and then you would want to try to immobilize that arm from one side to another to prevent any further damage. Would you want to try to pull it back into place? Yes or no? Would you want to try to straighten it out? No, 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 no. Well, most people say no, and for the most part, you're right, except if there's a prolonged, maybe, okay, and Getty, you'd be a good politician, maybe. What happens if these fingers are blue and cold and numb, and there's a long transport time to any type of medical facility? Then what's going on is this injury is compressing circulation to the distal or the distant part of the hand. if that continues to be allowed, that person could lose function of their hand permanently. So it would be appropriate, although not necessarily easy, to make one attempt to try to take one hand and straighten this out to try to restore circulation. It takes a little bit of mental strength to do it. You need to prepare the individual because it will hurt, but it's for the purpose of trying to save that extremity. And really, it's just one attempt. If the first attempt doesn't work, then don't keep just yanking and pulling and trying to pile drive that forearm. It's not going to work. Get 911 there as quickly as possible. So this is just a picture of a closed humerus or upper arm injury, very common in elderly. Usually it's signified by some deformity to mid-shaft humerus and an inability to raise their arm above their head. This is what a common anterior shoulder dislocation looks like. You see this nice rounded contour over here on the good shoulder. Over here you have this sharp step off on the bony structure, and what happened, the shoulder just came out of place. Very, very common when the arm is raised overhead and the shoulder is struck from behind, such as like when a quarterback is about to throw a football and they're tackled from behind. I used to see a lot of this when I worked across the street from the police academy in Manhattan, when they would teach these cadets boxing. And I don't know why they teach boxing in the police academy. It's not like police officers are allowed to box with perpetrators. If they do, they put on suspension and all that. But they have these young kids who, some of them never been in a street fight in their lives, in the ring trying to box. And what they're doing is they're throwing wild roundhouse punches. And a very common thing to happen is as one police cadet is throwing a wild roundhouse, the other one throws a punch right into their upper arm as they're swinging and knocks the arm right out of joint. And it hurts. What do you do for that as a first aid provider? Again, disregard what you usually see on TV, even what you read in the book. Do not try to make an attempt to relocate the shoulder itself. You can do more damage than good. First of all, they need to be in the ER. They need an x-ray, because even though it's a likely dislocation, you never rule out the possibility that you can have a break or a fracture along with the dislocation, in which case that needs surgery. Trying to put it back in place, you're only causing more damage. Sometimes these things are so strong that no matter how hard you try or how good your technique is, it can't be put back into place. The muscles start going into severe spasm, and sometimes they need to be sedated. They need to be in the ER with an IV, given multiple medications and monitored, something they call conscious sedation, to relax everything so they can put the joint back into place. Sometimes it's so bad they actually have to take them into the OR just to put them under general anesthesia because the muscles are so tight. So really, best thing to do would try to put that sling that you saw earlier on, immobilize the upper extremity, and call 911. Any MMA fans out there? This is someone that looks like they took a good tie kick right to the lower leg. That's a brutal injury. But again, what are you going to do as a first aid provider? First off, check the ABCs. Second, stabilize the injury, so manually, with one hand on each side. If it's an open injury, try to apply a sterile dressing to the area, control the bleeding, check for distal circulation, and call 911. We'll talk about some situations where it may be appropriate to try to splint or externally immobilize that extremity. And again, most of these injuries are very non-life-threatening, very minor. I'll show you one injury, though, that is particularly severe. And, a broken arm, a dislocated shoulder, a broken ankle, broken femur can be pretty devastating, can be pretty dangerous, can be pretty life-threatening. But most extremity injuries are not that serious, except a true dislocated knee. Not a dislocated kneecap, dislocated patella, a dislocated knee, where the femur and lower tib fib come apart from each other. This is an example of a patient I had in the emergency room. He was working up on his house, cleaning out his gutters and the ladder. He fell. His leg fell through the rungs of the ladder, and his own body weight just basically pulled his lower leg off from his upper leg, as you can see here. This guy has about a 50% chance of losing that lower leg. These are severe injuries. When someone is brought to the emergency room like this, we immediately call for an orthopedic surgeon to come down to the ER and a vascular surgeon to come down to the ER. Why do they have such a high likelihood of losing that extremity? Because you have an artery called the popliteal artery that runs right along the lower side of this leg. And as that leg is dislocated, it compresses that artery and cuts off blood flow all the way downwind. So this person needs to be sedated and they need to have that knee put back in before they even get up to the OR. That's why we have to call the specialist down from down to the ER. Now we had this patient in our ER and everything came into place beautifully. The EMTs called a notification, so we knew what was coming in right away. We got this person on the stretcher. We had an orthopedic doctor. We had the vascular doctor. We were able to give him some medication to sedate him a little bit. The orthopedic was able to lift it back up and put it back into place. And the foot went from blue to pink. The pulse was reestablished. Everything looked good until about 10 minutes later when that foot started turning blue again, started losing sensation in the foot, and started turning cold again. Well, what do you think happened? Well, yeah, we reestablished circulation initially, but from that 20-30 minutes that circulation was cut off, what happens to blood when it's not moving well? What does it do? It clots. Very good, Leslie. So what happened is the blood that was stagnant over here formed a clot. And so we reestablished blood flow. Eventually that clot broke off, traveled downstream where the arteries get smaller and smaller, and blocked off blood supply again. So we had to wind up going into the OR and getting that all cleaned out. So these are really severe injuries. So anything you see like this immediately demands a 911 response. So, but in any event, what do you do for dislocations? Same thing that you would do for suspected fractures. Check CSM, remember? Circulation, sensory, motor. Use what we call RICE procedures. Rest the extremity. Ice, if you have ice available, I'm sorry, ice to keep the swelling down. Compression to to keep down inflammation, and elevation if it doesn't aggravate the injury. Some organizations have a different meaning for RICE. The R would be rest, the I would be immobilization, the C would be compression, and I'm sorry, cold, and the E would be elevation. Whatever you decide to use. The bottom line is you want to try to keep that extremity as immobile as possible. If you have ice available to reduce the swelling, that's great. Elevation only if it doesn't aggravate the injury. And we'll talk about splinting just for a few moments, but we're not really going to emphasize splinting in this program because we don't really have the ability to put hands-on practice to it. Do not try to reduce the joint. What do I mean by reduce? Remember that angulated extremity? In general, you want to try to leave it as it is. So if you had that deformed forearm, for example, as long as the hand was warm, showed good signs of circulation, sensory, motor function, even as angulated as it was, you'd want to leave it in place. The only time you'd want to try to make one chance to reduce or to relocate that extremity is if it's showing signs of circulatory compromise, which we talked about. So, but otherwise, you really just kind of want to leave it in place. Okay. A general rule for applying ice to minor or major extremity injuries, and it's really no hard fast rules. I usually recommend ice 20 minutes on, 40 minutes off, as often as you can. If you can do it 3 times a day, that's good. 5 times is better. You should never put ice directly on the skin because you obviously know that'll cause damage to the skin through frostbite. It may also cause severe muscle contractions through shivering, which itself could aggravate the injury as well. So if you're going to use ice therapy, wrap it up in a towel. So, you know what works really good? A frozen bag of vegetables, peas, carrots, whatever you have. Put it on the extremity, let it there for 20 minutes, put it back in the freezer, refreeze it. Nothing works as good as ice, though. Chemical cold packs that you see in first aid bags are almost useless. They never get cold enough, and they don't stay cold very long. If that's all you have, that's all you have, but it's always better to use real ice in those chemical cold packs, just for your own knowledge. Well, let's talk a little bit about splinting extremities. It's a little more advanced part of the first aid. I wish, again, this is one of the things that makes me sad about not having a real in-person class is we don't get a chance to practice this. But splinting means putting some type of external, whoops, what happened here? Some type of external source to the extremity to keep it immobilized. So why do you want to splint an extremity? Well, it's going to reduce pain by reducing movement. It's going to help prevent damage to muscles, nerves, and blood vessels, which can occur if those bone fragments are moving around. Simple to say, it may help prevent a closed fracture from becoming an open fracture. You may see some of those pictures where it looks like a bone is just about to poke through a piece of skin. That's something we call tenting. That's something that's very, very likely to become an open fracture if it's mishandled. Just the compression from the splints itself can help reduce bleeding and swelling on the inside, and it helps the fractured bone into soft tissues like muscles, tendons, nerves. So it's definitely a good thing to do with proper training. Um, Even with or without splinting, there are some extremity injuries that require uh, definitive medical care. Extremity without a pulse, okay, where there's circulatory compromise, any type of open fracture, dislocation. Like I said, never try to relocate a joint by yourself. Any joint injury with moderate or severe swelling, where they lose function, where they lose ability to walk, or severe deformity. Now, 3 major types of splints I'd like you to be familiar with. One would be called an anatomic splint, where basically you use the body to splint itself. And so we talked about something like a rib injury or an extremity injury. You use a cravat to kind of tie the arm to the body, and that helps immobilize it. A great way to immobilize a pelvic fracture or a suspected pelvic fracture is to tie one leg to the other with maybe a little cushioning in between. That's a great anatomic splint. A lot of times when somebody breaks a finger or damages a finger, what we do is we buddy tape one finger to the other as an anatomic splint. You'll probably seen that all the time. It's kind of funny because my elderly father hurt his finger. He went to an orthopedic surgeon. The orthopedic surgeon took an x-ray. Nothing. There was a little tiny crack. So he took some gauze, took some tape, taped one finger to the other, and charged him $300 for the procedure. $300 for a piece of tape and a piece of gauze. I told my dad I would have done it for $100. He's got to come to me next time. Soft splints in a pinch, like a rolled up blanket or a rolled up pillow, are great for ankle and wrist injuries in a pinch. And then you have commercial or non-commercial rigid splints, something like boards, rolled up magazines, golf clubs, anything that can be tied to an extremity and prevent excess movement. I remember my my former EMT teacher telling me how she loved to play golf, and she used her golf clubs to help splint somebody who fell down and broke their ankle. These are all different methods of splinting. No one absolute 100% way of doing it correctly. But sometimes you just got to be a little bit creative. And that's basically all there is to it as far as musculoskeletal injuries. Are there any questions? I'll count to 10 for questions, and then we'll maybe preview some of the stuff I want you to focus on for next week's exam. All right, with that, I'm going to stop recording.